Hello, everyone. Welcome. I'm Dr. Selma Bartholomew. Welcome to our Legacy Community Conversations webinar. If you are just joining us, thank you so much for joining us. I'm Dr. Selma Bartholomew. Today's webinar is on the health crisis facing Black women. We've got a dynamic panel. And so if you're just joining us, we appreciate you taking the time out today to be with us as we discuss this important issue with our expert panel. Please be sure to subscribe to the channel, hit the like button, and I'm excited today to engage in this conversation on the health crisis facing Black women. For those of us who may not know that there's a health crisis, I'll certainly give some of the data in a minute. As you know, as our company Legacy Pathways, we do core work in teaching and learning and leading. And this conversation on health of Black women, someone might say, well, why are we talking about white women when we're much more engaged with our schools and with our students? And the reason why this conversation is so important is because we sometimes have the mindset that we can fix everything in a school building. Every single thing during the day, right? If you're a principal or a teacher, that we can do every single thing, and that is an enormous lift. But I think we have to do a better job of engaging our community. And if our moms are not healthy, if you can't put on your air mask as a mother, then how can you take care of your child? How can you take care of your husband? How can you take care of your loved ones? So today's conversation, for those who are just joining us, I'm Dr. B. Welcome to our community conversations with leaders. And the topic today is the health crisis facing Black women. Before I introduce the panel members, I want to give a few stats for those who may not think that there's a health crisis as we engage in this conversation. So the data says that the percent of aged women, Black women above 20 who's obese, we're at 56%. That more than 56% of us are noted as being obese. And more than 44% have high blood pressure, right? 44%, that's almost half. And what about those who may not have access to healthcare? So it says that in reality, we may be much higher than that 44. The leading cause of death is heart disease and cancer. So for those who are just joining us, thank you so much for joining our health conversation. And finally, the infant mortality rate above 10% for Black women and for us as women of color. And my final stat I want to say to you is that if you have a mom, a sister, if you're one of our males listening to this, if you've got a daughter or a mother, if you thought you were celebrating a birthday and having that wonderful birthday at 40, I think you need to move it ahead a little bit, because in reality, the life expectancy of Black women is barely 78. So today we're here to talk about the health crisis facing Black women. I'm honored to have a dynamic panel. And so we're going to get into the why and the why not. Why is this issue? But I also want to give a context of the why not. So the first person I have the honor of introducing is Ashley Wisdom. Ashley has her undergraduate degree in biology from Howard University. She's got a master's in public health from New York University. And the why not for her is, in spite of this, she could have been very comfy. And she said, why not challenge the status quo? Why not create a space for Black women in the health issue? So Ashley is an entrepreneur and leader of Health in Her Hue. So Ashley, I'm going to ask you to introduce yourself to the audience. Tell us about yourself. Tell us about Health in Her Hue. And my opening question for all of my panel members is, tell me one small thing you do for yourself. So, welcome to the community conversations, and I'm honored to have Ashley Wisdom. Ashley?
Thank you, Dr. B. First, thank you for having me on today. I'm excited to have this conversation with the other panelists. My name is Ashley Wisdom. I'm the founder and CEO of Health in Her Hue, as you said. And Health in Her Hue is a digital platform that connects Black women to Black and culturally competent healthcare providers. And we also provide health information and health media that centers the lived experiences of Black women. created Health in Her Hue because I saw that there was a gap in health information that really and truly reflected the experiences of Black women. And it's important for us to pursue health given our, and with understanding our social context. That's important. So the platform does that with on the content side. And then we also have a provider database where Black women can go in, type in their city and see what Black doctors, doulas, midwives are near them. Still in early stages of development, but that's Health in Her Hue. One thing that I do for myself on a weekly basis, given COVID and having to do the whole social distancing thing, I took the plunge and I invested in a Peloton bike so that I can ride that at least 3 times a week. Pretty pricey thing, but it's an investment in myself. And so that's one thing I try to do for myself on a weekly basis, to stay healthy and to stay in tune with myself.
Thank you, Ashley. Thank you so much for being here, and congratulations. For those who want to find her, it's healthinherhue.com. Please make sure that you go on and you subscribe, and it's dynamic and really powerful content. Thank you again. My next panel member, I'm honored to say she is a dear colleague and also a friend. Linda has more than 20 years of experience in radio personality. She's a retired educator and a real voice, and she has always motivated me about my health and my wellness. And so I'm honored to have Linda Mondesire and to have her introduce her radio show, Thinking Healthy Thoughts. Linda, thank you for joining us. Tell us about your work, and also what's the one small thing that you do for yourself?
Okay, I want to thank you so much for having me on. That's the first thing I want to do. And I also wanted to share that we were cohorts at Fordham University while we were doing our second master's degree. So we are very, very good friends and longtime friends and colleagues. Yes. Now, right now, what I'm doing, first of all, I spent 27 years as an educator. And then also before that, I was working in radio for 22 years and then came back as I retired in radio. So now I'm with WHCR 90.3 FM, and that's a Harlem-based radio station that's over in City College. In the show we have is called Harlem 411 and Beyond. And what we do is we interview everybody. We interview political people, we interview entertainers, we interview people who are in the economic business or commerce. And I also have a special segment that's called Thinking Healthy Thoughts. And what I do is I spend most of my time on that, talking about health and things that we need to do to better ourselves, because that's my main mission, is to get the knowledge to people, because I believe that lack of knowledge is a problem in our community. So the one thing that I do, or well, I shouldn't say one, I do a lot of things. I just wanted to piggyback off of our first guest panelist. I have 6 bikes in my home, and I have a recumbent bike, and I do ride the bikes. I try to exercise all the time. But one of the things I did want to share is that I look for nature in the middle of concrete, in the middle of the concrete jungle. I listen to the birds sing. I collect rocks. I do all of these things that help to ground me and to, and to bring me peace and joy. But the main thing that I do is I pray, I read the word, any word, a lot of different types of words, whatever way you choose to worship, and I meditate. So those are the things that I do. Thank you.
No, thank you, Linda, and thank you for making time for us. I'm honored to have our next panel member, and remember, we're talking about the why, but also the why not. And the why not for us is about dreaming. So for those who are just joining us, I'm Dr. Selma Bartholomew. This is our show, our webinar, Community Conversations with Leaders. Please don't forget to subscribe and like the channel. And today we're talking about the health crisis facing Black women, the why, but we have to now also talk about the why not. So my next panel member, Chantel Pipkin, her why not says, why not be a doula? Right? Why not? Right? We recognize the why, so why not dream a little bit? So I'm honored to introduce her. You are my first doula that I've actually met. Right?
Give it up for the doulas.
Also a mom And so thank you so much, Chantel. If you would introduce yourself, your work, your business, your company, and tell us also where to find you and the one small thing you do for yourself.
Okay, no problem. Hi, thank you so much for having me. I'm so excited to be a part of this panel. My name is Chantel Pipkin. I am the owner of Womb Sister LLC. Womb Sister provides birth options for many women, but especially for our Black and Brown women. I help with birth planning. I help them find providers. And then I try to help set the tone for what kind of birth, like when you visualize your birth, how do you want it to be done? What do you see? And then I try to help make that happen. I give childbirth education. And then afterwards, when they're in labor, I'm with them from when they're in labor until that baby comes out. When that baby comes out, I help with lactation because we all know that that liquid gold is best for them breast milk. I also founded an annual wellness event. So it's called Womb Fest. And Womb Fest is just to bring community, sisterhood, and empowerment back into what's going on in our society. I try every year to change the theme so that way we could focus on different stuff. So one year might be on maternal mortality and prosperity, and the other year is going to be business entrepreneurship, parenting. I just want to mix it up and build a good community for everybody. I'm also a mother of a 7-year-old. So we all know COVID has been very detrimental for them. So I'm trying to figure out inventive ways to keep him active. And
what's the one small thing that you do for yourself, especially as a mom of a 7-year-old?
Oh, actually, I like to paint. So lately people's been doing a lot of little Zoom paint sessions and stuff. So when things die down in the house, I like to find my own personal time and paint. Other than that, I have a spiritual advisor. So I meet with her every week just to talk about my mood, my anxiety, if I have anxiety, if it's good, and how to keep myself well-rounded. I'm so blessed for her. So that's how I stay grounded.
Awesome. Thank you. Thank you. For those who are joining us, I'm Dr. B. Our conversation, the health crisis facing Black women. The question on the floor, and certainly let me answer that as well. What's the one thing I do for myself? I'll probably do two. So you got to drink your water. Yes, on a daily basis. And a special shout out to my niece, Adora, who is also a nurse. And so lately she has gotten me up every morning, and we've been doing anything from a 15-minute to a 30-minute workout from YouTube, which I've always hated, but with her, it has actually been quite fun. So it's a really nice gift to get to spend that time with her and to make time for our health and wellness. What I want to get to is this question around changing the narrative first, right? I read some of the data, Chantel, you're a doula, the data around the death of Black women in childbirth, immediately after childbirth. It's just shocking, right? So even though we've had so many advancements in technology, we think we have access to our hospitals, the health outcomes continue to be dismal and disheartening. So what do we need to be intentional about? What do we need to be intentional about? I guess I'll start with Ashley, and then I'll go to Linda and then Chantel. So Ashley, based on your work and connecting with professionals in health in our hue, what do we need to be more intentional about?
So as Black women, I would say one of the things we need to be intentional about is being proactive about our health, being preventative, thinking about our health from a preventive standpoint and not just waiting until we get the diagnosis or we're told that there's some abnormality to start really focusing and prioritizing our health. So I think the starting point should be for us to stay as informed, and to the extent that we can. I know that insurance and access to care oftentimes is a barrier for Black women particularly, but for those of us who do have access, we should keep ourselves informed. When we go into a doctor's office, if there's something that's bringing us there, we should, do our preliminary research, jot down whatever symptoms we have going on, and make sure that when we go into that clinical visit, we address everything that we need to address with that provider. I think another thing we need to do is properly vet the doctors that we choose. I love that we have doulas now, especially for mothers. I think that healthcare is it's functioning as a business right now. And so as patients, we really should be positioning ourselves as consumers of care since it's a business. And so we have every right to be intentional about creating our care team. And so that's what I would encourage Black women to do, is stay informed, equip yourself with the questions and the information that you need when you go in for a clinical visit, and then also be very picky about who your care providers are.
Excellent. Thank you so much. Linda, what about you? What do you think we need to be more intentional about as we think about our health as Black women?
Okay, first of all, she said mostly what I would say too. Okay, those are the things, but I would add a little bit to that. I would say journal what you do on a daily basis. Journal your health, journal what's wrong with you, journal what happens to you, journal how you sleep, journal how you eat, journal, what vitamins you take, and then respond to that by thinking about what is it that's happening to your body. Listen to your body. That's one of the things that I think you should do. Also, I would go way back into self-esteem, because the only way we're going to change the narrative is how we feel about ourselves. And if we take the whole concept of bringing our self-esteem up, beginning to learn to love ourselves, love our hair, love our body, regardless to what anybody else says, it builds up your self-esteem, and then it allows you to go in and talk to your doctor. I do agree with her where it says that you have to speak up, but I think you should take that journal, the one that you have, take that journal into the office with you, because you'll forget certain things. And you may even forget what you jot down, right? Because I used to do that. I would jot it down just before I went to the doctor or whatever. And I would forget half the stuff that happened to me months ago or whatever. So that would be one of the things that I would do to change the narrative.
Excellent. Thank you so much. That is so true, because it's telling your story and that piece around that self-esteem, right? Because I feel like we get so busy and we've been so used to taking care of others, and we don't necessarily want to acknowledge our pain. We're told kind of suck it up and push it through. So that journaling does two things. It makes space for the mind and gives time to yourself, but it also becomes a tool. And I've never thought about that, to actually bring my journal into my doctor's office with me. That is an excellent strategy, and it's something that we can attain. Chantel, what do you feel like, if based on when you hear the data, especially in your field, especially in the field of birth and childbirth education, what do you feel we need to be more intentional about to change those outcomes for Black women?
First, I think it starts within our homes. Women, once we get pregnant, we start looking for guidance, and we look to our friends, our family for guidance. And at times we're not always given the best advice, because everybody just takes what's, this is what happens. This is how we birth. And this is just what you do. Go to the hospitals. I'm not against hospitals at all, but don't feel like birth should always be treated as an emergency situation. And because of that, I think it's time to start getting a little bit more grounded. Look at other options. What about birth centers? What about midwives? How often how much time does your provider give to you? If you don't feel comfortable talking to your provider, most likely they're not the one for you. You have to be able to be open and feel like your answers and concerns are at thought. So I think it starts at home. I think that as a collective, we need to support each other a lot more, figure out different traditions, build your own traditions and everything. But at the base of it, you definitely need to start investing in education. That's just it. Don't just take no for an answer. And if you're not sure about it, that's the option. You need to start exploring. People hire doulas to help them out, but at the end of the day, you're your own advocate. So you have to be able to get up there and take charge of your birth and try to educate yourself and see what's out there for yourself.
I don't think we even think of that. I think when we go to a health professional, we're not necessarily thinking that we should ask for choice. And with, right, especially if you're in a position where you have limited access to healthcare and the systems are already so overwhelmed, that we need to begin to have those options, and to be able to say that you have choice. I also feel like if in this conversation, it's also being more intentional, which is something I hear about voice, right? And being okay with sharing your voice and to be able, to push. But I want to first, I guess, ask then, what is self-care then? So, is it something, is it just enough to say, okay, I get up in the morning, I have my shower, I have my annual, exam? What is it that we need to think differently about what self-care is, and what does it look like, and what does it feel like? Linda, can I come to you first, and then Ashley with this? So what is self-care, and what does it mean to you based on your years of experience?
Okay, well, self-care for me is eating properly, obviously, sleeping properly, because some of the we don't really know, that we're sleeping properly. Like sometimes our mattresses may not be appropriate. We may be sleeping the wrong way, and then we end up getting sciatica or something like that. Our eating habits obviously create high blood pressure, diabetes, and all the other ailments that we have. And we need to supplement like vitamins. We need to take lots of supplements and herbs. It says in Genesis 1:20, I think it's 1:29, and I'm not trying to promote any Christianity or anything, but I'm just saying it does say there that, let your herbs, let every herb bearing seed be your medicine and food. So I would definitely say do that. I think that self-care, one of the biggest parts of self-care is dealing with your womb area, in terms of us as women. There are women out there who have never even seen their own vaginas. If you get what I'm saying, we don't take care of it. We allow people to abuse it. And I think that on that note, we should really be more mindful of that area of our body, because that's the thing that specializes us as women. There's a book from the Church of Scientology, and I'm not advocating the Church of Scientology, but they have this book called The Way to Happiness. And in it has all the different areas and components of how to be happy, how to take care of yourself. And I'm just saying that the suggestion would be to get information, provide yourself with a lot of information on how to take care of yourself, deal with your womb area, because that's very important, and eat and sleep properly.
Oh, that's great. That's great. And I think what you're saying is right to that. I hear information as this theme that's constantly
absolutely
through. So Ashley, in Health in Her Hue, based on the platform and you providing access to culturally care individuals who want to be in that space with Black women, what are you seeing or defining by way of health, health care, self-care?
Or self-care?
Yeah.
Yeah, so I would define self-care as being intentional about prioritizing stress management. So that means making sure you have a mental health provider, therapist. That's a big thing that I push. Healthy eating habits, as Linda mentioned, receiving enough sleep, and doing what you need to do to maintain physical activity. So all those things I am an advocate for, and I think Black women should prioritize. And it's much easier said than done when we are oftentimes heads of households, have jobs that, working multiple jobs, sometimes low wage jobs. So self-care is a very catchy and it's become a very consumerism focused term lately. But it is something that's important, especially for Black women, to prioritize, because we have that strong Black woman trope that says, or archetype that says that Black women we're resilient, we can take it all in, but we're human, we break just like anybody else. So we need to prioritize that. I do want to call out something. There was an article written by Dr. Melissa Harris Perry that talks about, squad care as opposed to self-care. And she challenges this idea of us being too focused on this individualistic approach to taking care of ourselves, that we live within communities, that we rely on our friends and our family members to take care of us. And so, especially as Black women and women of color, we should be prioritizing what she calls squad care, as opposed to self-care. We should be thinking about health and wellness in terms of community. But I do think that there's place and conversation for both things. But that's an important thing, and a mindset shift that I've had after reading her talk about squad care versus self-care.
It's so much easier to have a buddy, to have a partner, and to think about, right? Ain't nothing like a sister.
Right.
Or a brother, right? To be able to have that company as you engage in caring for yourself. Chantel, what would you say as you work with women and around this issue of childbirth education? What is self-care to you? What does it look like for you?
For me, I definitely think emotional and mental wellness, especially just for Black women in general. We carry so much on our shoulders, and sometimes we're not honest with ourselves. I feel like we're just in that go, go, go. And even though if you're feeling a lot of pressure, anxiety, or anything, your mechanism is to just keep going. It's the strength that we have in us. And sometimes we're not listening to ourselves. So when Linda said, be true to yourself, listen to yourself, know the cues of your body, you really have to be in tune with yourself and know when it's time to say stop, time to take a pause, time to get a wellness check, time to talk to somebody. A lot of women who come to me are scared. They're with a lot of the statistics going out, you know, we have so many women dying. We've had like within 4 months, about 3 women between New York and New Jersey who has already passed away through childbirth. And their anxiety levels for these women are detrimental. And as we know, stress can cause high blood pressure. I think when we look at the statistical rates of high blood pressure for us, we also need to look at the living status for Black women in general. You know, when we're sitting here watching some of our Black men dying, that causes stress. If you do have to balance 2 to 3 jobs, that is stress. Hearing somebody die during childbirth, that's increasing your stress levels. So I definitely believe in finding a great buddy system, finding somebody to let out your feelings to. Even with my prenatal visits with my clients, we have a fear session, because fear can turn into adrenaline, and adrenaline can stop their contractions. So, you know, to stop inhibiting that, let's talk about what's really scaring you during this pregnancy, during this childbirth, so we can figure out how we can ease that fear and make you way more confident. So I think in general, it's to become in tune with yourself and find a good outlet to speak on it.
Excellent. I so agree. I hear you need to pay attention to self. I talk a lot about compassion for self. You know, the fact that I didn't know that word in my 20s and my 30s, but now that Dr. B is 25 again, hello. Right? That I'm learning how to be compassionate. And I think we think compassion is for others rather than for ourselves. And Ashley, you said it so right. We wear this armor where we're constantly told, and we know why, we needed to push through, to suck it up, to, you know, to get over it and to weather it. And I'll share a very personal piece. I always thought that I took great care of myself. So I do go to the gym. I do drink water. I don't pick up the phone, you know, after 7 o'clock. And so, yes, my health has always mattered to me, and I'm always learning how to be better. But at the end of the year, I was diagnosed with breast cancer. What? That's what I thought, right? And just having to be able to say that out loud to my family, to my friends, is stressful in and of itself. And it occurred to me, I didn't buy it. Hello. No need to be ashamed of it, right? And so I feel like if as Black women, because it's not something that you see physically, right, on us, it's not something that's physical. Maybe the weight we carry, and we feel guilty all the time when we gain 5 pounds, but because it's not something physical, that there's a level of shame of, I'm not feeling well today, I'm tired. And so that shame of letting things go and saying to yourself, you didn't buy it, have compassion for yourself, and that you need to be able to truly let it go and ask for help, is something that we're not learning as Black women. And if we learn it, then we will teach it to our sons and to our daughters, right? And so it is an important piece for me as we have this conversation around taking care of yourself. Linda, I see you shaking your head. You want to comment?
No. I was just looking at something.
Yeah, so this idea of kind of compassion for ourselves and listening to ourselves. But I also want to get to another part of this discussion, because yes, we have to own it, but I want to talk about in a systemic way. Our healthcare professionals need to also do things differently, right? And what must they do differently? Because we can't just put it on us, this system, right? Of, oh, I'm doing something wrong, because there are more than enough doctors out there. And so yet still the scary data of we are dying in childbirth, the obesity rates and the rates are not changing for us. So I want to talk about, like, systemically in terms of health professionals, what do we need to do differently in terms of educating them? And I'm mindful of the time. For those who are just joining us, this is our community conversations with leaders. We're talking about the health crisis facing Black women. I'm Dr. B, Dr. Bartholomew. Our panel members, Ashley Wisdom, Linda Mondesire, and Chantel Pipkin are here today and just educating us about this issue and the why, as well as the why not. So talk to me a little bit about this systemic piece around the actual systems of healthcare professionals. What do they need to do differently if we're going to change these outcomes? If you can now actually celebrate your birthday at 40 instead of 38, given the life expectancy of Black women, and it's even lower for Black men. Ashley, your thoughts, given Health in Her Hue. For those who don't know, you can find them online, healthinherhue.com. So go ahead, Ashley.
Yeah, so I think the first thing that needs to be said is that we need our providers to check their biases. And that doesn't exclude the providers of color, because we all have our different biases. Black people, we have biases about, about other Black people. So it's not just the white providers that need to check their bias. Every provider needs to think about the ways that they're viewing their patients, and and challenge some of the initial thoughts. We're all humans, so that's work that we have to consistently do. So I think health systems need to be intentional about training their providers. Medical schools need to embed implicit bias training in their education of medical students. So it just doesn't need to be the clinical studies. We need to talk about racism as people are becoming doctors. We need to talk about the racism that is historically embedded in our healthcare system. So as the medical students are coming in, they know what to look out for. They know what policies and systemic things that they need to tackle and dismantle for our healthcare system to be safer for Black women. So I think that that's the first piece there. I know my platform is definitely trying to connect Black women to Black doctors and Black healthcare providers. I understand that that is not the panacea, that the solution shouldn't just be that because there's racism, we got to match all the Black patients with all the Black doctors. We need to address it from a systemic issue. I'm just using technology in the interim, but as a public health professional, I 100% believe that implicit bias training is something that needs to be done amongst providers writ large.
Ashley, can you just explain a little bit before I open up the question to Chantel and Linda? Can you just be very specific about how your platform works? Like, what is it that, for those who are listening, what do they need to do to connect with you on Health in Her Hue, and to be able to even register? What do they need to do?
Yeah, so we are still in the very early stages. So the app that you'll see on the website is just our prototype. Do not think that that is a fully furnished, polished app. But if you go on the website, you will find, if you're a doctor, if you're a Black doctor, you can go on there and sign up to be listed. If you're a patient looking for a Black provider, you can go on there, click on Find Provider, type in your city or select the specialty that you're looking for. And we're still getting providers onboarded, but you should be able to find a Black provider that you're looking for in your city. We also have health content on the site that's written by Black healthcare professionals. If you're a healthcare professional that's trying to understand Black women's experiences, we also have patient stories that are written on the platform. And finally, we also have a private community where there are healthcare providers, doulas, doctors, therapists, along with patients. They're in there, they're having conversations, we host events. And so it's a very dynamic platform, still developing it, but you can find all of that if you go to healthinherhue.com.
Excellent, and congrats on launching it. For those who are joining, please make sure you like and subscribe. Chantel, in your area of childbirth education, can you tell us what is it that systemically needs to be done differently if we're going to change the outcomes? I don't want to just put it on. I know we need to be attacking cultural beliefs and educating ourselves and going after the why not. But what is it that they need to be doing systemically to change some of these outcomes?
Some people don't know, because when they know me, they just know me as the womb sister, the doula, the childbirth educator, and everything. But I've also worked in a hospital for 9 years now. And honestly speaking, I just want, when it comes in between birth workers and the hospital world, sometimes there's controversy in between that. And I just need them. I'm gonna just say it. Nurses, we need you. Doctors, we need you, and we're definitely not against you. So we're here all to work for one, and that is the patient. We're here to help everybody out. I think what really needs to be done is to stop assuming. Yes, we hear these statistical data like Black people are higher with blood pressure. Black people have diabetes all the time. Not every Black person lifestyle is like that. Like, there's been times that I've been stereotyped and they didn't even know I was a vegetarian, you know, and they instantly assume because maybe I was a little curvy that, you know, I had nothing but salt all day. And it was quite surprising when they checked my status that I was completely healthy across the board. So it's to stop assuming and to start listening. I think that we all should I think they need to tap into what made you start. The New York lifestyle, the hospital lifestyle, it's so fast. It's for emergencies. It's for a fast pace and everything. And sometimes you want to get to so many different people that I think we're starting to lose the thought of, why did we get started in this? Mm-hmm. We're here to help everybody. And it shouldn't be about color, insurance, or anything. It's, you're here for help. Let me fully listen to you. That's the thing. Listen. We need to listen. Why are you here today? Let's listen to the cues and the stuff that you have to say. And if we start opening up why we really started, get grounded in that and start listening, it probably would go so much further.
It will, absolutely. Linda, what do we need to be doing differently systemically?
Okay, well, what I think, first of all, it's racism across the board, and we all are aware of that. I'm thinking that what we need to do is bring whatever it is that we need to I think it's one-on-one. You know, I mean, the other sister, she was talking about how you need to, you know, get out there and do more, but I'm saying one, the power of one. When you go to your doctor, I believe that you need to tell him what you want, or her what you want, and you can't really, you can look at skin color or whatever, but I've had, you know, it has to be based on the intelligence that the doctor has, not necessarily what the skin color is, because I've had Black doctors who literally was hurting me, and I had to move and change that. So what I'm saying is, you tell your doctor what you need. Again, I go back to the journal. Bring your journal in, and if they're not listening to you, well, money talks. Go to another one. Go find another one until you get the person that literally does what it is that you're looking for or what you're asking for, and learning to speak up. I think you have to be an advocate for yourself, you know, in this particular area.
As I thought about this question, it's really complex, right? Because you're absolutely right. There is this historical racism, which has ensured that our medical care providers haven't learned about who we are culturally. And so if they're going through medical school and it's all about, okay, you're going to be a GYN or whatever, and you're not connecting to who your patients are culturally and taking the time to know them, then you can't care for them. And then on the other hand, as women of color, because of that mindset where we've not had enough time to really talk about our story, Linda, because I don't think most of us
Yep.
I learned how to journal when I was 13 years old, right? So I do journal, but that's not something that most people do because they require time and quiet. And as for example, even this year, as I was going through this health issue, without being combative, people don't want you questioning authority, right? So here's
Yeah.
a questioning of authority and the cultural piece next. Every time I would go to my doctors over the past few months, and I've had really great care. I don't have an issue with my, with the I have had surgery, I've had, radiation or whatever, but I had to be so mindful because they would ask you the question as a woman with cancer, can you tell me, your family history? Well, ding, 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 ding. As women of color, we don't necessarily know our family history. So yes, ask the question, but are you going to create a space for us to be honest and say, no, I don't know if my great-great-grandmother or my grandmother had breast cancer or had an issue, because in reality, I don't even know what day my grandmother was born, right? And I don't want to be combative. So for that doctor, they might feel guilt or they might feel nervous about even opening up the question because they might think the answer is making them think, oh, I've done something wrong, where really we just want to be listened to, as Chantel is saying. We want to create a space where we can feel safe enough to say, I don't know my family history. And so maybe for us, in terms of systemically, there are some why not questions. Why not make the BRCA test? Or why not make some tests open to all Black women, right? Or some things available to us so we can at least begin to get some baseline data for our next generation of children.
Right.
So
But even
that piece, Linda?
Yeah, no, I was going to say, even if you don't, even if you don't know your history, if you have that journal and you can command, I'm saying command as opposed to demand, because they don't like that, and you have to speak up, you have to talk up. And then when you find what you're looking for, support it.
Yeah. Thank you for that. Absolutely. So for those who are listening, thank you for joining us. Please make sure you like and subscribe. So this voice piece is not something that necessarily carries itself to our youth, right? And to our young girls. So if we had to say something to our youth, to our younger women, to those who have both either a young woman or a young man, let's do first the young woman. What would you want to say to her? Or what would you want to say to those who have a young niece, who have, a child at that, at that age, at that developing stage, about their health and about them finding voice? So I know that's two questions. What should we say to them about their health? And how do we help them find their voice? So let's first do, what do we say to our young people about their health? Ashley?
So I think we should find age appropriate, content and information to give to young people. I know we're talking about girls, but also the young men as well.
Absolutely.
I think you were talking about family history, and a conversation I've had at a Health in Our Hue event was around women who experienced miscarriage, and they were saying how they felt alone and isolated, not knowing that their mom had a child, or their sister had a child, but not their mothers or their sisters never told them that they also experienced miscarriage. And so they were saying, if I knew that there was family history or there was precedence for this, I wouldn't have felt as alone in my experience. I also know a woman who gotten, done genetic testing because they knew that their mother got breast cancer at an early age, so it prompted them to go and get checked. So I think to the extent that we can, as Black women, have conversations and share family history, health history with those coming up behind us, that's an important thing that we should equip them with, so that when they do go to the doctor's office, they can say, yes, my family does have a history of diabetes, and so my doctor should be watching my A1Cs. Yes, my family does have a history of breast cancer, and so I probably should seek genetic testing before I turn 30, just in case. So those are the kinds of conversations I think we shouldn't be afraid to have with young people, and we shouldn't shy away from, because it's setting them up to take better preventative care for themselves.
Yeah, well said. And I love the app. I love Health in Her Hue. For those who don't know, you can find ashleyhealthinherhue.com. We have doula Chantel Pipkin. You can find Chantel on Yelp, and it's womb-sister. And our next panel, Linda Mondesire on the radio channel. And Linda, you'll share it again. So excellent in terms of being able to create that family tree and that family history. It might be something for your app, Ashley. Maybe there's a way in which for us to begin to collect that data, because we really don't have it, even the questions that we can ask. Chantel, what do we say to our youth about getting an understanding of how to help them to take ownership of their health?
And it's crazy because this has been coming up for weeks and weeks and weeks and weeks. I'm so serious. So I just feel like this is my ancestors talking to me like, Chantel, you gotta create some change. But honestly speaking, what I think is that it kind of starts a little bit within our parenthood in a way, you know, or what we see. And what I would say to our youth is, if you don't like it, it's time to create a change.
Ooh.
So that way, when our future generation comes, you are creating a change for them. One of the things that I had a great group that I was talking to last night, we was talking about how was it when you caught your menstrual? You know, becoming a woman, because, you know, when you catch your menstrual, it's like you're becoming a woman, your puberty and everything. And there were so many ladies who was just like, my mother just handed me some pads and was just like, you know, you just wear this, that's it, take some Tylenol and that's it. There was no like introductory to womanhood. And because of that, let me tell you something, Womb Fest is going to have like a red tent party. And what I mean by a red tent party, we're going to get together and we're going to have everybody come dressed up, feeling like goddesses. And we're going to talk about everything about womanhood. I mean, what could you use when you catch your menstrual, whether it's all cotton, whether it's a cup, and what other things could do to you? Holistic birth control options. Or if it is birth control, what does these different birth controls do for you? Or how should you hold yourself as a woman? What is okay to take from a relationship and not okay to take from a relationship? When a girl becomes a woman, it is scary. It's scary. And the way that we address it sets the tone to how they will address it for the future. So I tell the young ones, it starts with you. And we start off with a sisterly conversation. You know, I tell them anything that they want. You want to talk about sex? Let me tell you about sex so you could be safer. I think parents, we need to open up, and not just parents, because, you know, everybody has a different lifestyle, you know, so just us women, it is our job to help lead our generations. So when you see a young girl starting to hit that puberty or she has questions, it's our job to take the time to listen to them and give them answers. One of my friends, Vanessa, she's a principal, and she had her everyday, you know, a career day. And when I came in, it was for me to be there for the women, for the girls that day, let them know what it is that I do, but let them know what they should accept, what they shouldn't accept, and how to take care of their bodies. So it starts with us, but we need to let them know that it starts with you. Let's create this change for what you want.
Oh, I love it. That's the why not, right? Why not go forth? And we understand the why, which has brought us to this point, but we have to now do the why not. Why not begin to have those conversations? And for Legacy, the work that we do in our schools and in our classrooms, it is exactly about that voice, not for our young women and for our young men, because all of the images that they were getting about self is very low, and there's nothing countering that narrative and saying to them, you are enough, you are worthy, and there's a way in which you should be treated. And as you step into your womanhood, right, that it is not a scary thing, and it is something that you need to have the love and the support to even be able to say you don't feel well. In our schools, you know, we have all of these rules and things like that. And, you know, you may have a nurse, but not necessarily someone there to be able to say, right, I need a moment. And so for my principals, for my APs that we work with, they work hard to create that culture within their schools, but I know that that's not happening everywhere. And so thank you for that. Linda, what would you say to our youth? What would you say to them about their health?
Okay, well, first of all, I'd piggyback off of everything that was said already. And sometimes when you're the last person, you know, whatever, everybody said everything. So I'm going to go into the area of the internet. Our young people today are very much into the internet. And on some level, they may have a resistance towards listening to those who are older, because in their mindset, they may think that there's better information on the internet. So just like this situation that we're doing right now, this celebration, you could suggest to your younger people to listen to that, you know, or to listen to this program. and get that information from there. If they're not willing to listen, to an older person, for that, the internet is a big thing today. So this is where they're really getting most of their information. I would also say, let them come to you as opposed to you going to them. Let them ask the question. And when they ask the question, then you can feel free to answer it. Hopefully you will have the confidence, and, the support to be able to do that. But the main thing I'm thinking is love. You need to be, the relationships have to be developed in love and support and all of the, in order for it to happen, because there is a level of a generation gap that you're talking about. How do you help a younger person? We had that same thing when we were younger. We didn't listen. We didn't. Did you listen to all of the things your parents said? No, I don't think so. So I'm saying, choose programs on the internet like what we're doing right now and suggest that they listen to them.
Yeah. Well said. I'm going to ask the question also about our young men. For those who are listening, please like and subscribe. You can put your questions in the chat. I do have access to them. So for those who are listening, please do share your questions. Please share your comments. I also think that as we talk, and Linda, you hit it so well about relationships, that if we don't have real authentic relationships with our young women, then why should they come to us, right? And there is a lot out there, but we have to be intentional also. In my work, and I don't know if they're ideas, but when I was younger, it was, oh, are you there, God? It's me, Margaret, right? But what are the literatures? So as we talk about culturally responsive curriculum and things like that, we need to create a space for people who are connected to community to begin to produce the books. And if they have it, to begin to make it accessible to our children within our schools so that they see themselves in it, right? So that they see that there's the space for them to begin to ask some of those questions and to create a safe space. For our young boys, for our young men, a little bit of a different conversation, right? So what would you want to say to our young men? And for those who are listening, please like and subscribe. Please, you can put questions in the chat to our panel members. So because this conversation for me, is we're in this context of two things. We're certainly in this context around this Black Lives Matter, and we're looking to set an agenda, right? To move forward. So I have to think about the why not. We know the why, and we need to keep asking the why, but we now need to ask the why not as we begin to dream about, right, what we want that future to look like. I also have to mention COVID because I am a science person. And the scary thing about COVID-19, we know who's dying from it at alarming rates, but also it has these lingering effects, right? The effect on heart, the effect on your kidney. Well, who is it that's dying from heart disease? It's us. So in this context, as we think about our young men and Black Lives Matter, what do we want to say to our young men about their health and also helping to build that rapport and that relationship with their loved one, with their girlfriend? Chantel, I'll call you first, and then Ashley, as we kind of push time-wise. So what would you want to say to our young men? And you have a son, right? Am I correct?
Yes, I got
How old is he?
He's 7. My boy,
awesome.
Brandon, and he is a different soul. I don't talk to Brandon like he's a child. I talk to Brandon like he's an adult, and he's gonna give me that mature conversation right back. When COVID took place, I let him know how serious it was for him to wash his hands and to stay away and not to touch his open membranes, eyes, nose, mouth, and things like that. But also what's going around right now, Black Lives Matter and the police brutality, I also have to tell him that his voice counts. What your thoughts count, what you think matters, and what you do can change. Just recently, I had my son, I was speaking at a protest, and my son, he idolizes Martin Luther King, and he decided that he wanted to speak at the protest, a little 7-year-old boy in front of a whole group of people, and he let people know that, he wants to grow up to be a strong Black man, and leaders were and what he don't like, and how he just wants to be seen for him and not the color of his skin. I was so proud of him. So it's with them too, they are our leaders. You know, we need them to be our strong fathers, to be a stronger unit, to stick together, no fighting one another, to take charge of their own health. A lot of men don't want to get checked for their prostate.
Oh, that has to be another show. Yeah, absolutely.
So it's we need you. That's, as a matter of fact, just speaking to all the boys and men out here who are watching, we need you. We need you to stand up for us. We need you to stand up for yourself. You are the word. So, you know, and when it comes time for your help, you got to take charge, baby. We know we need you to get tested. And yes, get tested. Don't listen to what society say about that. Go get tested, because you getting tested can have you being here more. And other than that, learn about these herbs. You know, take your black seed oil, drink that mullein leaf, drink some water, you know, be engaged, be active. You know, it starts with you. We need you. You're our leaders.
Thank you. So I have a question from the audience. I'm mindful of the time. We have about 5 minutes, so I want to ask this question. I'm going to ask it to you, Ashley, because and anyone else who want to comment. The question says, COVID-19 has had the greatest impact on women, on Black women. How do we change larger policy, including pharmaceutical companies, to better support us? So the question about pharmaceuticals and supporting us in this context of the pandemic that we're in. So Ashley, your thoughts about this bigger issue around the pharmaceutical company as a public health expert?
Yes, I would say the pharmaceutical companies have a huge role to play, especially in communities of color, because they're making so much money off of us, given the fact that many of us are, you know, unfortunately have chronic diseases and are having to rely on a lot of their therapeutics. So they really do need to step up for us, because unfortunately we were some of their biggest customers, so to speak.
Yes.
And so there's something that needs to be said about the way that pharmaceutical companies, they shouldn't just be making a profit off of our illness. They need to be doing work to educate patients on how to manage their chronic conditions. So if you're diabetic and you need to manage your A1Cs, the company that you're relying on for medication, they should be equipping the doctors who are prescribing these medications with information to help you manage your conditions. It shouldn't be, we want you to stay diabetic so you can stay on our medications. And, you know, that's a whole, I know we're we're on a time crunch, so I can't get on my soapbox, but there's lots of things that these folks who are capitalizing off of our illness, they need to stop lobbying to protect their bottom lines, and they need to really do work to show up and make sure that communities of color are not being our conditions aren't being exacerbated, especially now in this pandemic. So I'll stop there.
I want to give a special shout out to my sister, who's also a nurse, and her team at Mount Sinai. She works in Mother Baby, but she has had more than a 25-year career. And she's always talking about the lack of the integration of things, right? Like you can, you know, you're treating one thing, but then it makes other things, right? Other parts of your system just crash. And so until we hold them accountable about being more holistic, I feel, about this in this space, it's absolutely critical. And also, I think we're not necessarily looking ahead. I think we've got a lot of cultural beliefs about this vaccine. And as scientists, we have not, I'll make the connection in terms of legacy pathways and what we do. We work hard to build relationships, content, and pedagogy. And no one is saying that our scientists, right, are not necessarily good communicators. And it's been this, you're this talented 10. So if you're in this space where you're not communicating and there's not that listening piece that Chantel is saying, then how do we begin to really move forward and recover and be right where we need to be in the context of this pandemic and our health? Linda, you wanted to comment, and then I have one final question for our panel as we come to our close. So I'm mindful of the time. So quick comment, Linda, around the phone.
Okay, all I'm going to do when you talk about pharmaceuticals, I just think that they need to be more mindful about nutrition. They need to, be educated on that. Or I think better yet, we need to be more educated on the aspects of nutrition, of holistic health, and vitamins and things like that, because most of the pharmaceuticals are really just synthetic, counterparts of something that is natural. And some things that we take, like for example, high blood pressure, most of the medications there have terrible side effects, and the side effects themselves create a horror. You know, I had high blood pressure. I do not have high blood pressure now, but I did have it, but I chose to exercise. I chose to eat right. I chose to cut out the salt, et cetera, et cetera. Now, the pharmaceuticals and the doctors did not agree with me, did not want me to do that. They wanted me to take medication that stayed on forever. I'm just saying, get to know your body, study your own, study nutrition, everybody should take a course in nutrition. And I need to do the same thing too. But we should take
it offered by some people who do it in, in that connected way.
Get a book, at least get a book. But know your body and know yourself. And I wouldn't rely, even if you have to take medication, understand it, and then look for the alternate too, so that you can work together with the nutritional part of it too.
I'm mindful of the time. For those who are with us, if you keep please add your questions in the chat. The panel members can go back at a later point and add to it. I want to make sure we can find everyone. Chantel, you on Yelp, and it's womb-assister.
No, so you could pretty much just Google me. If you put Chantel Pipkin or the Womb Sister in, everything will come up. But I am on Yelp. You just put the Womb Sister in, it will come up, or my name, Chantel Pipkin. I'm on Instagram as the Womb Sister, Facebook, the Womb Sister, or Doula Chantel Pipkin. And my website will be up soon. I do have another website. It is womb-fest.com, but soon it will be womb-sister.com as well.
Okay, we'll make sure and add it. You can find Ashley at Health in Her Hue. And so I have the last 2 minutes as we come to a close. And so very quick answer from my panels for those who are with us. Thank you for joining. I have one final question. What gives you the most joy in your work? You're passionate about health. What is it that brings you the most joy at this stage in your work? Ashley?
Knowing that Black women are seeing themselves in the care that they're trying to receive and are feeling more comfortable with the providers that they're finding on our platform. That brings me great joy.
Excellent. Chantel, what brings you the most joy?
When I get to the other side, the recovery part, when I know that they started their labor and they started off maybe with fear and not confident. And by the time they walked into that hospital birth center or at their home birth, they felt in charge and full of power. And towards the end, when I got a healthy baby and a healthy mommy, that gives me so much joy.
Yes. Linda?
I can't beat her.
Yes, right?
I can't beat having a baby, but I can say what gives me the most joy is just giving out information that other people may not have been able to accomplish or get to know or know about, and to enlighten them on other alternatives as opposed to just going that one route. And that is just straight to the doctor's office and trusting only in the medical industry that has not really respected us very well. So just giving out knowledge.
Okay. Yes. For me, I'm Dr. B. What brings me the most joy is voice. It's voice. I feel like we're at a place where our work in helping our students, our leaders, find their voice, craft their voice, own their voice, not bury it, is so important and so powerful to me, because as a leader, that's all you have is your voice. And I want our young people to see themselves as leaders and to then sooner or later get to be stewards, but to know that their voice matters and to not hide it at any point. For those who joined us, let me say thank you so much. This is our Community Conversations webinar with Legacy. Thank you to Ashley Wisdom, Health in Her Hue, Chantel Pipkin, a womb sister, and our radio personality, Linda Mondesire. Chantel, I had a question for you. I won't ask it. I was trying to figure out, we never talked about what is the belly binding, but hopefully we get to do it again. So yes. Thank you for joining us. We look forward to our next Community Conversations webinar. Please make sure you subscribe and like the channel, and we will keep you posted on our next session. We are going to do a special session on our correction systems and thinking about our young people in that space. We have Dr. Darby who will be joining us. And so please stay with us as we continue our community conversations with leaders. Thank you again so much for joining us. Thank you to our panel members, and wishing
You're welcome.
and a safe day.
Thank you, you too, Dr. B.
Thank you.